Despite dramatic improvements in dental care today, millions of Americans still suffer from tooth loss each year. Mostly due to tooth decay, gum disease, and injury, tooth loss is a condition that is more than cosmetic. Missing teeth can cause bone loss, affecting a person's facial structure, ability to speak and chew properly, and can have a serious effect on a person's self-esteem.
There are three major consequences that occur when a tooth is lost. First, the teeth on either side can shift and drift into a new position. This new position can negatively affect the patient's bite and chewing ability. Second, the bone in the area shrinks, much like a muscle atrophies when it's not in use. And third, our teeth function like a team, and when one of the players is missing, the other teeth have to work extra hard. This additional stress can cause those other teeth to break down over time.
Tooth loss was once only treatable with the use of bridges and dentures, but today more and more people are opting to correct the condition with the use of dental implants, a technique that many agree does more than simply replace a person's teeth.
A dental implant is the only treatment option that solves all the problems created by a missing tooth. Essentially, a dental implant is a titanium root, so it preserves the patient's bone. Additionally, the crown that's on top of the implant prevents shifting of the neighboring teeth, as well as creating optimal biting and chewing ability.
Treating tooth loss with the use of bridges, dentures, and implants each offer significant advantages as well as certain disadvantages depending on a person's budget, lifestyle, and concerns.
The advantages of bridges and dentures over implants is that the treatment time is relatively shorter. They can take a month or less, whereas dental implants can take 3 or 4 months to complete to replace the tooth. One of the main disadvantages of a denture is that it rests on gum tissue and bone, and this can lead to sore spots. Over time, the bone under the denture will shrink away, causing the denture to become loose, and this is going to require the replacement or repair of the denture. Bridges on natural teeth compromise the adjacent teeth by cutting down the adjacent teeth, and they can be subject to decay because they're more difficult to clean. When the decay occurs, the tooth can be lost, thereby compromising the support of the bridge, or they can require root canal therapies.
Most dental experts agree implants are the most durable and comfortable option available to treat tooth loss today. A treatment that involves implanting artificial dental roots made of titanium to the jawbone without damaging adjacent teeth, implants provide a natural look and feel as well as the same strength of chewing as the teeth you were born with.
Dental implant is the closest thing to replace your natural tooth. It doesn't get decay, it doesn't have root canal problems, it helps support the jawbone, and over time it will be the strongest tooth in your mouth and hopefully lasts forever.
Clinical studies show that the overall success rate in patients with dental implants range between 90 and 100%. With proper care, implants can be used for as long as 30 years, making the initial investment lower in the long run when compared to dentures and bridges.
All dental treatment, much like the cars we drive every day, have a certain lifespan. To understand why dental implants are the best choice long-term economically, we have to take a look at the alternative treatment options such as a 3-tooth bridge. A 3-tooth bridge requires the dentist to drill down 2 healthy teeth on either side of the missing space to replace 1 tooth. If a problem arises with the bridge in the future, such as a cavity, the entire bridge needs to be replaced. Oftentimes, a replacement bridge needs to be extended to 4 or 5 teeth, which is a tremendous biologic and financial cost to the patient. In comparison, the dental implant option leaves the teeth on either side untouched. If a problem arises with the dental implant in the future, such as screw loosening or porcelain chipping, the fix is rather simple and much less costly to the patient than replacing it with a bridge.
When I was in college, I was in a serious field hockey accident and actually lost my front tooth. And, being so young when the accident happened, I was so worried about what my smile was going to look like for the rest of my life. So after speaking with my parents and my doctors, I decided to go with a dental implant because it was, I didn't have to worry about, was it going to come loose, was it going to affect me when I was eating, when I was speaking. I can go out and be with my friends and not have to worry that anyone even knew I had a dental implant. And ultimately I'm very happy that I went that route.
Dental experts agree that the earlier people address tooth loss and seek treatment, the less costly and more effective implants can be. The diagnosis and treatment process for a dental implant is a simple and relatively pain-free experience, and is completed over the course of 3 to 4 months. However, a variety of new implant methods are emerging, holding the promise of significantly shortening the treatment period.
Doctors are more and more using digital imaging, which allows them the treatment plan before the patient even arrives. And what that does is allows the patient to get their implant much quicker and less chair time. Also, the shape of the implant and the surface treatment allows for much quicker healing time. And what that ultimately means is that that patient gets an implant much quicker.
As a subsidiary of Ostem Implant, one of the top implant companies in the world, Hiossen Inc. is dedicated to helping dentists deliver the most advanced and reliable implant technology available today to their patients. Continually searching for the most cutting-edge and competitive technology, Hiossen is working towards becoming the world's leading dental implant provider.
Hiossen's vision is to have a very rigorous research and development department. And what that allows us to do is to bring the latest advancements in dental implant technology to our dentists. Hiossen is striving to become the world's leading dental implant provider by having a strong commitment to continued education in the local marketplace, and that allows us to train our doctors so they have these latest advancements so they can help their patients.
Hiossen, where beautiful results take shape. For more information about dental implants, please visit Hiossen.com.